Put some air in. Yeah. Suction. Good. Now put air in again. Right, now advance your scope. Yeah. Let's keep advancing. Did you see the power?
Yes, sir.
Good. Suction. No bubbles. Okay, fine. Go ahead.
Just saw that, sir.
Yeah, good. Well done. If you saw it, just keep going in.
For a split of a second, sir. That is
That's fine. Even if you saw it for half a second, it's fine. You saw it. Yeah, good. That's it. So now, again, bubbles to utne aa rahe hain. Suction करें थोड़ा. That's it. Okay. Now, you can already see the
Yes,
ampoule,
sir.
right?
Sir. It's in the 9 o'clock position. 7.
Okay, wherever.
7
You can see it. Fine. Now, position it for yourself the way you thought. What are you doing?
I'm trying to go beyond papilla.
You don't have to go beyond the papilla. You've already got it in front of you, right? Yeah. Okay. Pull back a little bit.
Pulling back, sir.
Yeah.
Back, sir.
Little bit. Okay. Perfect. Now pull back a bit more. Lean a little bit away from you.
کروں میں کیونکہ یہ بینڈ ہونا شروع ہو جاتا ہے.
So I brought the ampulla very close to me to stabilize the position here.
ٹھیک.
Okay, good. Go on. Go on.
I think you made the turn, so
Yeah.
that's good.
Yeah, that's good. That's divine intervention.
ابھی یہ وسیم کریڈٹ لے گا لیکن اس کا کوئی کام نہیں ہے
اس میں اس کا دور دور تک تعلق نہیں تھا. یہ تو چاہ رہا ہے وائر نکل آئے. کسی نے اس کو پیسے بھی دیے مجھے پتا چلا.
ہاں یہ صحت ایسے تھوڑی بنتی ہے.
بہت ساری شکایتیں ہیں میرے پاس, ابھی میں کروں گا صاحب. Okay, so we've gone. Now I think we may be coming out of the minor.
Either minor or uncinate.
Yeah, I'll say yeah, minor or uncinate, but we've got reasonable position. It's a floppy tip wire. It's 0.25, so now we are okay. Chalo. So give me a 5-3. Ready? Sorry, Dr. Fahd.
No, sir.
If you had done this, I would have blamed you, but now I can't blame anyone.
Your plan is to put a PT stent small.
Yeah.
And are you gonna try to cannulate first? Or are you going straight for needle knife? Can you show just trying to cannulate above the PD before going for needle knife?
No. I'm going to attempt cannulating. I always do that.
Okay.
I put a pancreatic stent now. I usually avoid using double wire, to be honest.
I think it's going to be tricky in this case.
No, even
because
otherwise,
the ball is not too
even
deep.
otherwise, I feel that in double wire at least, the wire going into the pancreatic duct becomes, sometimes goes in a little bit as you're trying to advance everything else and you're focusing on cannulating. And that, reading so much about you guys writing with the wire and pancreatic duct injury, I feel once you've got into the pancreatic duct, maybe, I find that I just put a stent in and get out. And then try and see if you can cannulate. If you can't, then you can either do a... okay. See, I think that should be enough. Okay, all out. Wire with a...
So it may be sometimes a little bit challenging when you put a stent in there. So its orifice is now completely occupied by that. But you still can try to use the wire tip and try to go above that.
So I totally agree. I think it becomes challenging. But if you are able to put the wire through, then it almost always goes into the CBD.
Yeah.
Okay, wire. Tip. Immediately
I am not a big fan of that, okay, personally. But because the reason for that is what we call a septotomy, ठीक है ना? तो लोग ये करते हैं, वो septotomy के बजाय ना वो pancreatic sphincterotomy करते हैं, ठीक है? जब pancreatic sphincterotomy होती है, so it becomes really difficult to get into the bile duct because now you have opened up the pancreatic duct. So you can do a septotomy, but that should stay only to the mucosal layer. Should not be cutting the sphincter a lot of that. Unless it's a common sphincter, in that case it can help. But I'm not a big fan. I try not to do that. I like, actually, I discourage people doing that.
So we got the wire engaged a little bit, and it's a question of Wasim is trying to see if he can get a little bit more wire in. which will then enable us to actually advance. I'm just giving him support, so see if he can. Right? No. Right? I'll give it another 30 seconds, and if not, then I'll just use it. Although the wire is gone in, but it's not going deep. एक second.
You give a
Chalo.
little bit, yeah, support, maybe he is able
Chalo,
to
try.
push that.
No.
Fluoro दिखा देंगे, where is the wire?
Yeah, wherever it is, it's not enough. Chalo. Throw us a bow, karo. Throw us a bow. Huh? डालो, pull back करके डालो. डालो. No, yeah, give me a needle knife.
It's a really a nice mount to do a needle knife, ठीक है? लेकिन ये कि again needle knife has to be careful. You can go from bottom up or top down. And the way I choose that is like whatever is easily and more controllable for me. And I'll do what I call a dry run. Try from the bottom up, see if that goes in the right direction, or from top down. That is more easier to control. So it doesn't really matter which way you do it.
Hello.
I think it's you see that it's appearing right at the top.
Yeah. So Khalid, I almost always do in most cases, 95% of times I go from below upwards.
Yeah, below.
I'm more comfortable doing that, and in this case, especially because you've got a pancreatic stent, then it becomes very easy. So a needle, a wire, sorry.
So can you see the bile duct, Jason?
You can guess it. Exactly, bile duct. Chalo. Wash another. So I've got a relatively superficial cut, but because I could see this, I am going to try this and then see. Wash.
Saad,
Yeah.
I think you are just on the surface of the outer.
I know.
So you can just make one nice cut and that will go take you in.
Wash the needle cut. Adrenaline wash. This is where I feel sometimes the adrenaline spray helps. This little, clearing area and capillary bleeding just makes the area wash. Needle. Ready? Wash. I bet there will be no stone here. Bare? You know? Wash them. Keep washing them. Wash. So a bit of bile coming out. Chalo, cut देना मुझे needle दो. Ready? Wash. Wash. Bare?
Sabe, if I think you cut that mucosa right above the stent, that would split it open.
Hey, I just saw bile coming out, so I'm just going to see if I can put a wire in, then I'm good. It's a pretty swollen like it's a large ampulla, so you have a lot of space there. Under normal circumstances, I would have just gone in and cut. But I think in a course where we have, chalo wire do. Die. Okay. Oh, interesting. Keep injecting. Okay. Stop. Wire को ऊपर लेके जाना है मैंने. Right, pull back. Yeah, go on straight. No, pull back. Yeah. नहीं जा रहा. थोड़ा सा ऊपर आने दो मुझे. चलो डालो. Yeah, good. Inject now. So we have a stricture here.
Yeah, that's what it looks like, and the distal bile duct is not dilated
Not
at all.
No.
Yeah.
And you have a. Let's see if this picture is a little bit better with the long scope.